So we will discuss right now the national brain health plans in the context of the brain economy. And of course, a number of countries have already formulated their brain plans. Others are doing so or planning to do so. And we are very privileged to be able to draw today on the experience of, well, two Nordic countries, Finland and Sweden. You can stay here and then speak and then join the panel. We also will hear from one of the world's most populous country, India. And we will hear from the perspective of patients who are obviously at the center of attention in the brain plans. So that's the idea for today's discussion. But rather than sort of compare and run through the brain plans as they are, I think the question that we will want to focus upon is what is the brain economy angle, right? So what's the broader framing of these brain plans in order for the political priority also to be sufficiently attached to how to advance these brain plans. And we'll start with Finland, because I think Finland's brain health program may be the closest to a brain economy approach, because it is fairly comprehensive. It covers a range of issues. And I would like to ask Mika Pyykkö from the Finnish Brain Association to take us through it.
Thank you, Paweł, and good afternoon, dear colleagues. After very sophisticated and high-level talks, I have a feeling that I'm almost brutal when I'm going to now tell you about very practical way what we have done and what we are doing in Finland in terms of our brain health program. I'm here because Finnish Brain Association was in charge of preparing our program, and we are also in charge of implementation of it. But I have to say that during this autumn, I'm working for the Finnish government. One minister of our government asked me to do one special task for the government, and during this autumn, I don't have anything to do with the Finnish Brain Association, but I have allowed to tell you about our program. And because I'm working for the Finnish government at the moment, I have to start my story by reminding you that Finnish government's approach is very much a well-being economy in principle. Our government stands behind this kind of principles. Johan already told you what that means in practice, but if I'm honest, this implementation, it's not going too well at the moment. These are very nice sentences, and they are included to our document, but in practice, to be honest, we don't do too much. And but anyway, based on that kind of idea approach, we prepared our national brain health program in 2022, and we had 3 or 4 that kind of main principles which guided our preparation. One was that we want to establish impact-based program. So we have measurable impact goals and outcome goals. And then we wanted to be very proactive. That means that we wanted to focus on factors that are very useful and important and our people. And as a starting point of our program, we wanted to focus on executive factors. I'm a social scientist, so don't wait that I'm going to tell something from the medical point of view. But anyway, I understand that we focused on executive functions because we had an idea that if we can enhance, strengthen executive functions, every people can do good choices in terms of living habits or everything. And maybe you can catch the idea which is behind our program. So we wanted to be very proactive and focus on executive functions in order to make life as good as possible. And this is the summary of our national program. And everybody can catch out those most important things. The impact goal of our program is humanly sustainable brain health supportive society. And we have an idea that, and we are realistic, that we are not able to achieve that very soon, but we are thinking now the time span until end of this decade. So we have a plan until end of 2029, but we understand at the same time that this is just the start for the longer process, longer way to really create this kind of society. And in order to be able to create that kind of society, we have 4 outcome goals, and you can read from here that the understanding of brain health and conditions and so on have been strengthened. Brain economics have been applied to operating environments, and you have to remember that we really want to focus on executive functions. And the sleep is one of our outcome goals, and then that the social connections, because we have an idea that nobody brain feels well without connection to other brain. These are those 4 outcome goals which we want to achieve in order to be able to achieve the impact goal in the longer term. And it's a very pragmatic way. We want to remind that those very traditional things like physical activity, healthy diet, and those things are also very important in terms of brain health and brain capital, as we call it in Finland. And all the time, we are also calculating what kind of advantage we can achieve in terms of money, in terms of cost reduction, if we are able to achieve these goals. So we come very close to the idea of brain economy. And one more thing is that we don't want to go straight to the human skin, as we say in Finland, but we want to make structural changes happen in our society. We really want to develop our circumstances, our society, favorable brain health, brain capital. Because at least in Finland, we are very used to ask people to do this and that and different kind of things in terms of physical activity, in terms of healthy diet. So we had an idea that now it's time our society to show that it's really a Nordic welfare state, and it's able to change circumstances and possibilities for everyone to make that kind of healthy choices, brain healthy choices easy, as you asked a little bit earlier today. That is our brain principle behind this all. And of course, because in my past I have been working in terms of impact investing 8 years, and we heard already the perspective of investors, and that is also in our mind that we have to be able to determine the final goal, and then whatever is done, it has to be based on the idea that we are able to achieve the goal. And that means that we have to be able to create this kind of ecosystem that everybody goes to the same direction and everybody knows its own role as a part of this kind of ecosystem. I run through very, very quickly, and I'm happy to answer your question later on during the reception. And we are not able to do this all by ourselves, by Finnish Brain Association. So we have 5 main cooperation partners with whom we are doing this all. We are coordinating implementation, we are planning everything, and finding out the best possible players in terms of different goals, because we have an idea that in terms of the ecosystem idea and in terms of those each outcome goals, we have to be able to find and create that kind of dream team to work together, and by that way we are able to achieve those goals. And of course we have one neurologist who is always there and make sure that our approach is really that kind of brain health, brain capital approach, that it's nothing else. And this year we have focused on sleep, so we are starting this campaign that everybody should understand really what is the importance of sleep in terms of brain health and brain capital. And we were lucky to get our parliament to involve to this campaign, and you know, at least our members of parliament, we have 200 members of parliament, they are working almost 24/7, and it has been like that kind of let's say good starting point for the discussion further and more broader about brain health and brain capital when we have stopped them to think that how important is sleep and what kind of influences is that if you don't sleep you are not making very good decision, and we can see that in everyday life and so on and so on. And these are some examples of our other activities. For example, at the moment we are talking very much about digital devices in Finland. I know that there's a lot of talk about mobiles in the States also, but in Finland we are talking more larger about digital devices and what is the influence to children's brain when they are using those digital devices. And we have that kind of pilot project going on with the city of Helsinki, our capital city, and there is about 35,000 school children, students in Helsinki, and now we are trying to find the balance how to use digi devices and use those as a part of the school, but not too much. And at the same time, the city of Helsinki has asked help how to design brain healthy schools. As we just heard before, that we are doing that very much in practice, that how we really can design that kind of brain healthy schools and that kind of brain healthy environments for those school children. And then after today, some of my friends have seen this slide before, but after I have been involved in this kind of events now this year, and after listening to all species, I have an idea that we have to understand that in fact, under the term of brain health, we are talking a little bit different factors, a little bit different issues, and all are very much okay. But we have to understand that to be able to use the term brain health, brain capital, brain economy, the best possible way, we have to understand, make that, and also make clear that we have different kind of approaches, we have different kind of perspective, but we have at the same time be able to combine those old perspectives and in that way strengthen our new ideas. And I'm always said that the real and sustainable impact also in terms of brain capital is based on co-creation and collaboration. That's I really believe in this kind of factors or way of doing. Thank you.
Thank you so much, Mika. And I'll be super interested to explore a little bit what you said at the end, namely how do we define these terms, well, nationally to start with? Do we need some sort of conversation to have similar understanding across nations, right? To be in the same space, more or less. But let's come back to this in a second. Since Rajendra also has slides, I suggest that we ask him now to speak about India. Rajendra Damija is head of the Indian Brain Health Task Force. You have the unenviable or enviable task of looking after the brain health of one of the world's largest populations. So with all the more interest, we'll listen to your presentation.
Thank you very much, and good evening to everyone. At the outset, I must thank Harris, Paweł, and other people who have arranged this meeting and give this opportunity to me to speak to all of you. And I represent one of the largest neuropsychiatric hospital in India. These are my personal views. I'm not. This is my disclaimer that I'm not speaking on behalf of the Government of India. This is all my personal, and I work for the Government of India. But this presentation is on my own because I, as a clinician, all my life worked in many countries, including Australia, India, and UK. That experience brings me back to the India, and I'm working there in a country which is very diverse, heterogeneous population, 1.4 billion, with huge disparities in terms of income, in terms of cultural, in terms of language, in terms of different geopolitical situations in the different parts of the country. So accessibility, availability, affordability, acceptability, they're all different in different parts of the country in terms of brain health and neurological disorders. So I am the professor of neurology, but at the same time I'm trained in public health. So that brings me to this platform talking about the brain health from the public health perspective and brain economics, how it is related to a country like India, where we have just started the National Task Force on Brain Health. So we will be learning from others. This is just the beginning. I don't have the outcome which we will be having in next couple of years, but we have plans in place and we have just started. We have already had 5 meetings talking to different stakeholders in the country, representatives of the different neurological associations having their inputs, and then economists and then the other stakeholders. So I'll be talking mainly on the neurological burden in the country and how we have to handle that burden. As you know that every third individual is affected by the neurological condition. This is not me, but the WHO talking about the leading cause of disability and the ill health in the world is now neurological disorders. So 1 in 3 means you can imagine 3 billion people worldwide having one or the other neurological disorders, including the mental health disorders. So if you see this from the WHO, why I'm showing this slide is each size does not fit all. So we have a different population, we have a different disease pattern, we have a different conditions, we have a different response to that. If you see globally, the stroke, migraine, dementias, meningitis, epilepsy, these are top 5. But if you see at India, the stroke is number 1, of course, migraine is there, but number 3 is epilepsy. Epilepsy is not a disease, it's a syndrome, it's a different dimensions. It's a social issues. It has a epilepsy with marriage, epilepsy with driving, epilepsy with pregnancy. There's so many issues with epilepsy. So that numbers 10 million people having epilepsy in India at the moment, which are really underrepresented. You can see number 4 is the infections. Number 3 is of course infections, and number 4 is epilepsy. So non-communicable diseases on one hand are growing up. At the same time, a country like India is also struggling to handle communicable diseases, that infectious disease, including the meningitis and encephalitis, infections of brain. So these 5 are little different from the global perspective. So you can have stroke, migraine, but at the moment, epilepsy, meningitis, or all these things are different from the global perspective. And these are those conditions which are seen worldwide, a little bit different in the lower and middle income countries, including India. Now, brain health also has a mental health component to it, and mental health is becoming, after COVID-19, a very big issue. You can see the figures from the global level, figures from the different countries, and lastly, the economics of that. $16 trillion as per the World Economic Forum. That is economic output because of the mental disorders. So that is why we need to talk about it, and I'm glad that we are talking about it at this platform and as the other platforms. And in India also, more awareness, more public participation is now happening. People are coming up with the mental health demand or the mental health, professional health. So that is very important. We live in an era where we have a stigma. Mental health stigma is a big issue. My hospital used to be called as Mental Hospital Delhi. So 30 years ago, we had to change the name to Institute of Human Behavior and Allied Sciences. So there is no word mental health in the institute. That is just to destigmatize and to increase the mental health literacy of the population. So we changed the name, and the dividends came up immediately after changing the name because of the stigma was removed. So that is very important to talk about mental health, and there is a rising trend. You can see the numbers of people having mental issues, particularly after COVID-19, have increased a lot. And you can see the social, cultural determinants of mental health. There are 3 tiers. We have been talking since morning, the climate, the environmental, the social, and the cultural. economics, demographics. All these things we have discussed it. And all of them have a very, very important the issues and factors when we determine the mental health problem of a country like India. So all of them, community, individual, traumas, infrastructure, economic recessions, all these can lead to job losses. They all lead to the mental health issues, and that is very important. And if you see the economic burden, you can compare with diabetes, cardiovascular, chronic respiratory disease, cancer. You can see the mental health is the top. So that is where we need to talk about. The economic burden is huge. This is just the mental health. I'm not talking about the brain disorders or neurological disorders. So we need to discuss this when we talk about brain economics or brain capital, that there is an issue of mental health. And not only this, there's a huge gap of treatment or treatment gap in the mental disorders in India. It's to the tune of 70 to 80%. That means the 70 to 80% of the people with mental illness does not have access to the basic drugs or basic professional help from the mental health professionals, whether it is psychiatrists or it is psychologists or it is psychiatric social workers or it is a psychiatric nursing. So that is, you can see from different diseases, right from 70 to 86% treatment gap. This is huge, and that is the mandate of National Task Force on the Brain Health in India, how to reduce this and how can they do that. The other issue is the suicide rate. You will be shocked to listen or shocked to hear that the young students at the age of 16 to 18, there is a huge increased number of suicides happening in the country because of the peer pressure, because of the pressure to excel in the academics, because of the adjustment problems. So every month we hear students committing suicide in a higher institutions of learning. So every state has that a problem. And in one state, in one city in India, that's a quota where 25 suicides have happened from the age of 16 to 18, 20, 23 only. So that is where we stand, and this number is increasing. Of course, we have a number of 170,000 suicides happening every year from the National Crime Report Bureau, but that's very understated and underreported. There is an incidence of 12 per 100,000 suicide happening, and you can see the rates from the Ministry of Home Affairs in India, the suicides happening, and it's a different state having a different ratio. So that is the magnitude of the problem, burden of the problems of suicide, and we have a national suicide prevention strategy which was launched last year, and we have been having wellness clinics in the institutes of higher learning so that people can have an access in case of crisis. So just to give a snapshot of how the population of a most populous country in the world is today, this is a little more than 1.4 billion now. 70% still lives in the rural areas. The migration is happening from rural to urban areas in terms of job seeking, but still a lot of majority of the population lives in the rural areas, which depend upon the public health institutions, and urban, of course, there is a much more accessibility. So having said that, India spends 1.1% of its GDP on the public health system from the government side. That's from the taxpayers' money. However, 4 to 5% is from the private sector or the healthcare industry, as we call it, from the corporate hospital. So 1.1% is nothing if you compare it, trillion, the fifth largest economy in the world, aspiring to be third largest economy after US and China. So that is where the expenditure on health, since we are talking on a brain economy or economics, the expenditure is meager, it's too low, the burden is so high. So that is why I want to highlight. So we have been, talking about the opportunities, challenges in the brain health, what the government should do it, and we have done it. This is all my efforts to create from the government side that what we can do for the brain health and how we can create the policy makers to hear about us and plan accordingly. So these are the numbers which are in the literature, so that you can see the 10 million people having epilepsy, 1 million people in Parkinson. One thing very is clear, there is a transition, economic transition happening. People are becoming rich, but still there is a lot of disparity. While economic transition also lead to lifestyle diseases, and poor control of lifestyle diseases has given rise to the more number of strokes. In the Western countries, the stroke prevalence and the stroke mortality is decreasing or has reduced, while in India it has doubled in last 10 years. So that shows that either the population is aging, there are more number of strokes, and the lifestyle diseases are increasing, and that is why the number of strokes are rising at alarming stage. This stroke does not mean that there is a mortality. Stroke also means there will be stroke survivors with disability, and these are burden on the community, and the effort to reintegrate into community is again a challenge for all of us. So that is something which we also look at. The dementia. You can convert the number of into the dollars per 150 billion rupees is the underestimation of the expenditure on dementia alone. Similarly, population is aging. In 2050, we will have more than 20% of the people living over the age of 60 years. That means every fifth individual in India would be having in that age group. And that is something which is glaring at us, how to plan to handle those numbers. Coming to the numbers of healthcare workers or neurologists, you can see in comparison to the other countries like Europe and America, the Southeast Asian ratio, this one is, these countries, including India, has one neurologist per 100,000 people. So one neurologist, one neurologist per million people. So that is where we stand, only one per 1 million. And that is around 3,000 neurologists all over the country to look after 1.4 billion people. So that is where, this is just, last year we had a global burden of disease study where each state, we had come to the numbers of having different diseases pattern. So in last 10 years, there are three clear-cut messages coming from the global burden of disease study, that number of communicable neurological disorders like meningitis and encephalitis has come down, while the number of non-communicable disorders like stroke, dementia, neurodegenerative disorders have gone up, and number of injury-related neurological disorders like traumatic brain injury, head injury, spinal cord injury, they have gone up. So that is very clear, and all states have a different kind of a heterogeneous structure. As I told you, population is different, so are the neurological disorders are different. So why we talk about brain health in a country like India? Because of the reducing the large and growing healthcare burden, which I showed you, and of course it goes beyond the disease or treatment. We have to have preventive, promotive, curative, as well as rehabilitative services to improve the brain health of the population. So that is 4 pillars, what we call them: preventive or surveillance, again promotive, curative, as well as rehabilitative. So that is something which we have been doing it, and of course not only the brain health but also mental health, substance abuse and other things, they are equally responsible, then we have to do it. So having said that, the efforts of for last few years brought to the policy makers and the government, and finally in April 2024, the government of India actually formed a national task force under my chairmanship, and there are different stakeholders from different ministries. There are about 10 people, main people, and 10 co-opted members: Department of Disability, Department of Education, Department of the main stakeholders from the different hospitals, including the All India Institute of Medical Sciences, and from the Planning Commission. So Planning Commission is the key agency here, and which is headed by none other than Honorable Prime Minister of India. He is the chairperson of this Planning Commission, which is which has come up with this national task force. You can see the term of reference are very clear, that we need to recommend the pathways to improve accessibility and quality of brain health at primary, secondary and tertiary health care level. So India has done a very good in primary health care. They have established 170,000 primary health care centers in last 10 years. 170,000 working primary health care centers. So they are the first line of defense, and we are trying to train those doctors and community health workers to recognize the brain disorders, and of course strengthening a robust structure way of providing a timely diagnosis, of course formulating strategy for promotion, management of in these primary health care centers, and of course rehabilitation, which is negligible, and palliative care, which is again non-existent in this country. So I'll briefly talk about what we are determinants which we are looking at. Of course, physical health. Physical health is one aspect. Healthy environments, we have talked about a lot since morning. Safety and security, learning and social connection. As we said, brains need to talk to each other to have a communication, and of course accessibility is again. These are the 5 pillars or 5 determinants, and then when we have these 5 determinants, we have to have a optimization of these 5 pillars to the brain function and the brain structure to enhance the well-being, and they are very important in terms of state of brain functioning, so that they can have important, and not only the lifelong, It's just not the childhood, adulthood, adolescent. All through the life, these 5 pillars are important: physical health, healthy environment, safety and security. And these are one of the National Task Force of India looking at this, how to have these things. And we are also looking at the other actions at global level, how we can improve the health, brain health for the human development. And this is something we published last year. Again, we have also gone through the other national plans, awareness campaigns, and we are looking at this, and we are having to look at the WHO IGAP implementation for epilepsy and other chronic neurological disorders by 2030. That is our plan, and that is one of the reasons why we have a national task force. So we have to have an integrated approach. So we saw the Finnish approach. We also have the urban healthcare centers, primary healthcare centers, and of course they are all connected, whether it is neurological disorders or it is mental health, and of course all the 4 pillars which I said: prevention, promotion, curative, rehabilitation, and that is a continuum of integration of brain health program. So these we have taken a bundled approach, and that bundled approach is actually a national plan which will examine the gaps first and then needs related to neurological conditions, and of course we will invite the multiple stakeholders. We already have 5 meetings from the different stakeholders, and we are continuing to have another one. We plan to have 100 such stakeholders on board so that we can plan and then give it to the government to implement in next 5 years. So that is where, just for the benefit of the audience, since we have been talking about brain health and brain economy, these are the 6 things, lifestyle behaviors, which we feel that are important to improve the brain health, whether it's social connections, engaging your brain or challenging your brain, and managing stress and at the workplace or at home, of course physical activity, sleep, and of course diet and nutrition. These are the lifestyle behaviors, but how they are going to benefit? Of course the cognitive resilience or the cognitive reserve, of course they are all benefits, and of course the bottom line is improving the quality of life. That is where we are committed to, and that is something in terms of sustainable SDG goals. And you can see brain health is in the center of all the SDG, particularly SDG 3, good health and well-being. This is a UN goal, and brain health comes in all of them. And with that, I'll finish this. Thank you very much for your kind attention. And I think this message should also go across: having a good diet rich in fruits. That is very important. If you ask me 3 takeaways: cut down your salt, cut down your sugars, and eat these fruits. Be different colors, all colors. So that will improve your brain health. Thank you for your kind attention.
Okay, thank you so much, Rajender. And if I could now welcome also Orla, Galvin, Executive Director of EFNA, the European Federation of Neurological Associations, and Anna Hemlin, the Secretary General of the Swedish Brain Foundation. And I would like to start with you, Orla, perhaps and I'll be curious about 2 things. First of all, the brain economy approach, brain capital, and the patients, right? I mean, what can the patients obtain from this approach? Like what they can benefit from this approach in their efforts also within the broader governance context to see more attention given to patient inclusion. So that would be one question. And secondly, if you could maybe give an example of how your advocacy efforts have been recently translated into action within this brain economy context.
Okay, so I'll try and keep my examples to but a few. For those of you who aren't aware, Raj's presentation set it up nicely. 1 in 3 people, so look to the person to your left and the person to your right, 1 in 3 people will be affected by a neurological condition in their lifetime. In Europe, where EFNA is based and the region that we mostly represent, this number is approaching 1 in 2. So to understand, again, a little more about the severity and the urgency, in Europe, by 2030, we are going to be short in healthcare 1 million doctors and 2 million nurses. So when we talk about the current state of play and looking to the future, the time for brain health and brain capital and brain skills is now. In fact, it's yesterday, because we're in a really tricky situation. When it comes to policy and advocacy efforts, Data that is published and why you should engage with patient organizations. For those of you representing industry, when you have patient involvement in your R&D and development, if you take oncology as an example, you get 500-fold return rate of investment. So that's one side of things. When it comes to the implementation, there's power in numbers. So yes, we have a number of policies in place, but when we unite all of neurology as a whole, all of brain health as a whole, it makes it easier for governments to say yes. And that is what we want to achieve. Because we have brain plans from different countries. We have the WHO IGAP in Europe. We have the Non-Communicable Disease Initiative that has a mental health and neurological conditions strand. But what we need to do is look at what we already have in place, yes, in Europe, but at a national level. And that is where the power of patient advocacy can really come in. And Deborah Castell, who shared with us the IGAP earlier today, and Rajinder, who shared with us the approach in India, and Mika, who showed us neurology through the life course and brain health through the life course, show and highlight the fact that we have to work together, we're stronger connected. So that really sets the scene as to how patient advocacy at national levels work. I'll be biased and I'll give an example from Ireland first, if you can't tell by my accent. So the Neurological Alliance of Ireland, which represents 40 patient organisations, came together with the clinical leads of the 4 major hospitals, the 4 major neurological clinical leads. They approached government, they got in front of Parliament and requested 400 additional neurological nurses. And because they were speaking with a united voice, the government said yes. So that plan has already begun to roll out. EFNA, together with the European Academy of Neurology, set up a global partnership called One Neurology to speak with one voice, again, so that people will find it easier to say yes to our policy asks. With the One Neurology partnership, we get insight to what happens all across the globe. We have 15 member organizations and 16 ambassadors. Professor Rajinder here beside me is one of those exemplar ambassadors, and you see the fantastic work that the ambassadors do. But let's talk about governments interacting with other governments. So what we have learned is that sometimes, and I'll give the European-US example, when myself and our senior policy advisor there today, Tavares, went to Luxembourg to speak with DG Santé, we were talking about all the facts and figures for about 45, 50 minutes. But when we made the comparison between Europe and the US, then they listened. Then that competitive edge cropped in. So an example of where this happens in patient advocacy, the Neurological Alliance of England, which represents over 90 patient organisations, the Neurological Alliance in New Zealand, and the Neurological Alliance in Australia. I believe there's 2 and a bit Australians here anyway. What they are doing is having a sneaky competitive edge with their government. So they're writing to their governments with respect to what their governments are doing in relation to the WHO IGAP. So the NAI, or the Neurological Alliance in England, already have their response. I believe New Zealand will be next and Australia will follow, and they're going to publish it. They're going to publish what the governments say they are doing, and then there will be a level of accountability, but also a level of, well, what are you doing versus what are we doing? How can we do better? In the interest of time, I'll stop there, but I'm around for chats later.
Brilliant. Thank you very much. It also shows how these different processes nationally are interacting, right? Namely, now one national brain plan in one country and another brain plan somewhere else. Now that creates the basis for a conversation. And Anna, if I could turn to you, because the Swedish brain plan is relatively recent, if I understand correctly. The idea originated, I think, in 2021, and then in 2023, under your leadership, the brain plan was put forward, right? So if you could tell us a little bit about the specificity of the Swedish approach.
Well, I'm Anna Hemlin. I'm the Secretary General of the Swedish Brain Foundation, and we mostly put most of our effort into funding research in Sweden, neuroscience research. But we also try to raise acknowledgement around and consciousness around the brain overall. Reaching out for decision makers and individuals who are interested in making their lives better and just use their brains better. So we started after meeting the European Brain Council and take up on their call to make every country should have a brain plan, and so we were intrigued by that, and then we heard that Norway had a brain health plan, so we started to think about this, and then we figured, well, health plan is not enough in the way we use the word health in Sweden. We wanted a broader concept, and I had been just for the year ahead, just past, talked to a lot of parents who had children in school, discussing how school's not working for them, and I figured there must be something more than, it's not only healthcare, it's not only school, there is more to this with the brain. So I'm not a professor or anything, I'm in marketing and communication, so this was all new to me, and I figured we must really do something different. So we figured we wanted to embrace the whole brain. And so we did that, and we also invited then a group of experts, all from professors, researchers, politicians, experts in different ways into a group, and they made a big effort. They put a lot of time into this. I'm glad our organization didn't have to pay for it because they worked very hard, ambitious. And they wrote this plan for us, and we then made it to ours, one can say. And it's actually, we have been working on it and trying to raise awareness of it. Meeting politicians, people in business, grassroots, philanthropists, all kinds of people. Everyone is interested, but not much happened.
Super, thank you so much. Orla, I can see you attempted to follow up.
I am, because I have to say I'm so sorry. I jumped straight into the tactical response to your question, and I didn't actually answer the impact part of your question.
Super.
So in terms of the impact to achieving the implementation of brain health plans, because we're establishing so many at global, at European and national level, implementation is the critical component. Otherwise, it's just a policy document sitting on a shelf. And what it means for patients is that we get earlier diagnosis, better treatment, better care. Yes, that's under the health sector bucket, but actually the biggest impact to people living with neurological conditions is everything else. It's the stigma, the discrimination, the isolation. Without a diagnosis, you don't get any access to services and support. You get further, well, we could call it abuse if you like, because you have the negative consequences in your education, the negative consequences in your work. We get people being fired, being managed out. We've seen earlier today the number of presentations where the relatability to being able to work and mental health and even suicide has a profound impact. When we talk about brain health plans, yes, they're for everyone. So yes, we do mean for people living with neurological and mental health conditions, keeping in mind that with chronic progressive conditions like neurological conditions, the top 3 mental health conditions associated with that are depression, anxiety, and financial stress. So when we take this brain health concept, yes, the individuals affected, but also the families and the caregivers. And this thought sprang to my mind this morning when I think Harris mentioned about the fact that the first panel were all phenomenal women. Well, actually, when it comes to providing care, keeping in mind, for example, in Europe, close to 1 in 2 people living with a neurological condition, we actually have 7.7 million women. I'm sure men provide great care too, but we've 7.7 million women out of the labour market because they're providing care. So these are all things that are really important to factor into brain health plans. The other thing that you may have already seen on some of the slides is that urban-rural divide and accessibility. All of these points need to be included in the brain health plans.
Greatly relevant points. We have to slowly move on, and I want to ask you a final question with a request for a brief comment. So we discussed over lunch with Rajender the dynamic which should be in place to formulate these brain plans, namely, should it be more bottom-up, so of associations, different communities formulating their ideas, this being aggregated and then the plan being formulated, or should it be more top-down, in which case the governments are more likely to be involved with the respective funding? So that's one question. And the second, again, brief question, so literally intuitive answers would be appreciated. Brain health plans versus brain economy plans. Is it one or the other? Is it both, ideally? And if so, what should be the sequence? Rajender?
Thank you. I think it has to be a balance between top-down or the bottom-up approach. Both have their own advantage and both have their own problems. So I think each country has a different dynamics. So depending upon that, one has to take a call. But in general, I think the both are important and a balance of both should be taken in. And we learn from each other. No size fits all. So obviously we are learning from Finnish and we're learning from others. And being a very heterogeneous population with rural-urban divide and inclusiveness, equity problems and all these things are happening. A country like India would have a different approach from the country like Finland. So obviously, we have to take good points from each other and then make a balanced approach. On the question of brain economy, brain capital and brain health, of course, they are all together. One is dependent on the other. Better brains would lead to the better economy. That is the bottom line.
Super. Thank you so much. Maybe we go to Mika first, who started our discussion.
I'm not sure if I answer your question, but I would like to encourage us to take the term brain capital very seriously. I don't mean that we don't have to care about diagnostics and good treatment and that kind of things, but I really believe that we can achieve something new and we can really deliver additional value to our societies if we are brave enough to enhance brain health, brain capital as a starting point of brain economy. I have been working for years in terms of health and well-being, but before I started in a brain association, I didn't understand how crucial organ brain is. Everything starts from brain. That's the reason that I said that we are focusing on executive functions, because it's a basis on good politics, it's basis on sustainable development, it's basis on good business, it's basis on everything. So I really encourage us to use that opportunity to enhance brain health, brain capital, and to be able then to create that kind of brain capital-based brain economy.
Absolutely.
I think the microphones are also slowly getting exhausted. Anyway, I think it's extremely important to sort of adjust also to the given country's predominant narrative, right? Because I would imagine that there will be places where it's more about brain health because there are needs which are more fundamental. And there are countries where brain capital would resonate very strongly and encompass brain health. Anna, what would be your take?
Well, I think, first of all, for me, it's also that we should use our brain as an asset, and that we we haven't reached our full potential. I'm from Sweden. We have a good welfare program. We have pretty good schools. Compared to the rest of the world, we are in a very good place.
Almost as good as in Finland.
Yeah. Yeah, they are more lucky than us, I've heard, statistically. And I want everyone to be as happy as they can. And I understand that we have different difficulties in different countries. But if we see it also, it's a loss that we don't use our brain as good as we can. We're not as happy as we can. Doesn't have our lives are not as rich as they could be. And the countries we live in doesn't have the possibility to compete with other countries as they should be. So that I think, and to answer the question top bottom or bottom up, I think that we've been here today. I've been here from this morning, and most of you maybe have, and it's pretty complex, isn't it? To ask for grassroots or people, and of course we could do that, but it takes a lot of resources, I think, and we're talking about light at workplaces. We're talking about exercise, how to have, what kind of infrastructures we should have. In Sweden, we do a lot of bicycling. I look out the window, I don't see very many bicycles, and if I do, they don't have a helmet. And that most of them have in Sweden, and it is very difficult to walk. You can walk. I have very many steps on my phone, and so we really, I think it's too complex, but we should absolutely listen to people.
Yeah, perfect. And Orla, the final word.
I'll be quick. So answer question one. Neurology patients and caregivers have the brain skills and brain capital like adaptability, creativity, innovation and resilience through necessity, I might add, that both go hand in hand. Brain health, brain capital. That's short answer. Short answer number two to question two. Remind me question two.
Question two was bottom up, and then there was brain health, brain economy.
So if we look at other plans like cancer plans, diabetes plans, you have to take the country that you're addressing and build on what's already there. That's just route to success.
So just to add to what we have discussed, two things are coming up in a science very importantly. One is that walking is a new medicine. We were talking about cycling. So walking is a new medicine. Sitting is new smoking. So the more you sit, you don't stretch your legs, you have more of a problem. The more you walk, more you do physical exercise. It's not only good for brain, but overall fitness, of a cognitive fitness. We all talk about physical fitness or medical fitness, but now the cognitive fitness is equally important, or rather more important, when you challenge your brain in one way or the other way, so that you can have a better cognitive reserve. So that cognitive reserve is a new term where your brain has a capacity to adjust to a new challenge. If something happens, so brain can adapt itself for a plasticity that can face the challenge.
Okay, so clearly we have to plan next year's summit a little bit differently, namely some at least walk and talk meetings in the course of the day, less sitting, and maybe differently arranged space as we...
You can't, your brain doesn't work after 45 minutes? That's no news.
Right, okay, very good. So clearly 2025 will be completely different. Lessons learned, of course. No, but thank you very much, because I think what is happening in the brain health plan space is extremely significant. This can leverage very impactful action. And thinking about the brain economy plans also makes a lot of sense, even though the concept is novel, because it could help to draw attention to the centrality of the brain, which is what we want to achieve at the end of the day. Thank you very much to all the panelists, and I hand over to Rim Ayadi for the panel on brain skills.